therefore been undertaking engagements with social partners and other stakeholders on introducing measures that can make vaccination a condition for access to workplaces, public events, public transport, and public establishments. Now, these engagements include discussions that we've been having at the NEDLEC level between government, labor, business, and the community constituency, where there is already broad agreement on the need for such measures. Government has set up a task team that will undertake broad consultations on making vaccination mandatory for specific activities and locations. That is, to make vaccinations compulsory for certain locations and certain activities.
President Cyril Ramaphosa has set up a task team to explore the possibility of mandatory vaccines for certain sectors. This comes as Business for South Africa calls for restrictions to public places, including restaurants, for those who are not vaccinated. But there are concerns about individual rights being violated. Joining me now to talk about this is Afro Women Womanist Movement of South Africa founder Mandisa Mashego, Business for South Africa chairperson Martin Kingston, founder of the Afro Womanist Movement there, Mandisa Mashego, rather, Professor Musa Mushabela, and the acting Deputy Vice Chancellor for Research and Innovation at the University of KwaZulu-Natal, COSATU's Parliamentary Coordinator Matthew Parks, and ACDP leader Reverend Kenneth Mishwe, as well as Labour lawyer Michael Begraham. And of course, you're part of this conversation tonight by letting us in on what your views are. The prospect of being barred from your place of work because you're unvaccinated, will that convince you to get the jab? 072-110-5584. You can tweet us tonight at Newzroom 405. Good evening to you all, and thank you very much for your time and joining us tonight on In Focus. Let me tell you how we're going to proceed for this debate. I'll give you all in this particular segment at least 2 minutes each to give us your initial opening remarks on when do you think it is ethically justifiable to put in place public health mandates, and then we'll give each other that opportunity, and then we'll get into a more shorter time period in the next segment. So let's start with Prof. Mushabela on this one. When is a public health mandate ethically justifiable?
Greetings to you, Tabo, and to the viewers and the panel members. I think that from a public health perspective, when we have a public health threat that has the proportionality, which means that the risk of it would outweigh the sort of argument against a mandate, the benefit would outweigh the risk, then it means then that we can actually lean more on the benefits of a mandate. And a lot of the time, you know, we're talking about the mandatory, we're talking about compulsory, we're talking about forced. One can reduce those to semantics and actually focus more on what issue we are dealing with. So the public health threat that we are faced with has to have the proportionality of risk to actually justify a mandate to be put in place. And we have examples of that. So, for example, with smoking, we have smoking mandates that essentially helps to protect the public from the threat of smoking. So in this case also, we are going to look at the threat of not vaccinating, the threat of the spread of the SARS-CoV-2 virus, and then weigh that against the benefit. I think we are arriving at a point whereby it's clear that for as long as the vaccination coverage remains low, then it is actually predisposing us as a public and as a country to threats of lockdowns, and we don't want to go that route. The threats to economy, we don't necessarily want to lose that, as well as the threat of new variants that we are faced with. So when we start to weigh those, we are seeing that the threat is much greater, and we need to make sure that we can go with solutions that may include mandates.
All right, Prof, your 2 minutes are up. Rev Mishri, let's bring you in here. Business may lawfully, from what I understand, require workers to get vaccinated as a condition of coming to the place of work as per occupational health requirements. Should the private sector be given this discretion?
Good evening to you, Julie, and to all the panelists and viewers at home. One important thing that I want to start with that we should all remember is that we are given constitutional rights. We come out of a dispensation when people of my color, black people, did not have constitutional rights. They did not have the liberty and the freedom to choose which doctor to consult, which hospital to go to, which school to go to, and many other exclusions that were imposed on us. Because during apartheid, we are also not allowed to go to some hospitals. It is not fair and it is not constitutional at this stage for people to be told that you have to do something that undermines your constitutional right, even though you do not want to be vaccinated. You are forced, whether directly or indirectly, you are forced to take it so that you can keep your job or you can go into whatever restaurant you want to go to. Constitutional amendments would have to take place before such mandates are imposed on the citizens of South Africa. So the ACDB believes that the freedoms that we fought hard to win have to be protected at all costs.
All right, Rev, let's leave it there for now. 2 minutes is up. Martin Kingston, let's bring you in. It's no doubt that at 21%, that deep concerns over a lagging vaccination rate in South Africa. And if we seek to reach herd immunity, we need to be vaccinating more. But there seems to be a worry that we are now departing from our values of individual liberty, the concept of autonomy and self-rule.
Well, Thabo, good evening to you and the viewers and indeed the other panel members. Unfortunately, individual liberties does not trump the need to protect the majority of society. And that's really what we're talking about. We need to put it in context. 260,000 excess or surplus deaths since the pandemic arrived in South Africa, many of which could have been avoided not just through people exercising caution and observing non-pharmaceutical interventions, which they're not, mask wearing, social distancing, hand washing, ventilation, but being vaccinated. We could have saved literally hundreds of thousands of people's lives, and that's what we need to do going forward. The second point is, as you've already said, the existing regulations that the likes of Matthew and I negotiated at NEDLAC, the occupational health and safety regulations, provide for employers to protect the health and welfare of their workforce, just as a landlord can protect those who come onto his or her premises. That is what we're talking about. If we were at the 70 or 80% that we all aspired to be, we've got the vaccines, we've got the capacity, both fixed and mobile. We're vaccinating between 120 and 140,000 a day. I was pleased to see today we did 160,000. We should be at 400, 420,000 a day. We wouldn't be having this discussion right now. What we've seen around the world is that when restrictions are put in place, albeit curbing civil liberties, it boosts the level of vaccination, it protects the population at large, and it prevents us having to put in place increased lockdown measures, which our economy can no longer afford, given our very fragile state. So as far as we're concerned, we need, of course, to hear everybody's views, but the time has passed to be able to ensure that everybody can behave as they feel like it in an anarchic environment. We cannot have that. We need to have a disciplined approach to rolling out the vaccine. It's been proved scientifically.
I've got to come in there, Martin, because unfortunately 2 minutes are up, so I've got to move on. I'll come back to you. Martin, let's bring you in here from a point of view of natural remedies, right? We seem to have reached a worrying plateau in the context of vaccination in the country. Hence, we are moving towards this idea and conversation around mandatory vaccine. Is this the only alternative we have? Please unmute if you can, please. Mandisa, you're still muted. Please unmute for us.
I apologize.
There you are.
Thank you very much for your patience, Thabo, and I appreciate this invitation because we need to have conversations that are pluralistic and not conversations that are fear-mongering. Especially as a Black woman, fear and intimidation and coercion and all these manipulative tactics that we've seen in Africa over the last at least active 600 years. And I'm saying 600 when you consider the North African invasions of Europeans around that time. With us, it's about 300 and just under 380 years. But we had invasions in Africa before that, about 5,000 years ago. It was the Arabs. And the reason I'm bringing in a colonial picture is because we have what is called neo-colonialism. We have imperialism now making its advances at a much, much higher and faster rate. Is there a problem with disease in the world? Of course, there's disease everywhere. Our bodies are born with disease. We're born with fungi, we are born with viruses, and we are born with bacteria. Whether it's good or bad is another story. So there is something called natural health and natural medicine. As Africans who practice indigenous medicine up to today, and indigenous health practices through nutrition, which are very helpful in being preventative of all sorts of conditions, including the chronic illnesses that we have that are cardiovascular, which are said to be a huge threat to the coronavirus. But before I go deep into my 2 minutes, I want to dispel one mistruth that was shared by the gentleman, I think it's Martin Kingston, who spoke now, who said there are 200 and something related COVID deaths. That's not true. According to government statistics, currently we have 89,797 deaths that can be attributed to COVID. And we all know that our health departments on the government side in South Africa are putrid, are disgusting. We all know that we don't have a cohesive health sector in South Africa between private and government, and that is why we can't even get government to implement a strategy.
2 minutes up, Mandisa. We'll come back to you and interrogate that a little bit further. Let's bring you in here, Michael, from a constitutionality point of view. I mean, does the state have a constitutional authority to mandate vaccinations?
Yes, they do, and let's not get it confused. Everyone has a constitutional right, that's fine. But you don't have a right that overrides the rights of the group, as Martin said so earlier. And if you want to have a job and you want to go and have the consultation with regard to the job, then unfortunately you have to take the good with the bad. So you have a constitutional right not to be vaccinated, that's fine. But you don't have a constitutional right to force yourself into a job. You don't have a constitutional right to go into a restaurant. If in fact it's become a problem, and if in fact the health and safety regulations are advisory in the sense that you want to make a safe place for your staff or for the customers, that you have a right to do. We have that legislation in place already. We're not saying that we're going to destroy your constitutional rights. What the country is saying is that we have an obligation in terms of the workplace to ensure that the group is safe. And when the group are threatened by an individual who has not been vaccinated, who are you going to talk to? Who are you going to side with? Obviously the group. The reality is, and this is a reality, in South Africa we've got a low vaccination rate. It's spreading. And the only way we're going to stop the spread is by ensuring that we follow the health and safety regulations and the legislation. The legislation's been in place. When someone has TB, you don't allow them into the workplace. You ensure that they first get the medication and that they're compliant to the medication, and then you bring them into the workplace. There's nothing new about this. This is legislation in place already. So I don't believe the president is doing anything different or new. All the president is saying is that what we are allowing is for after consultation with the staff and after checking the operational requirements, that's what we're going to do.
I'm going to come in there, and let's bring you in, Matthew Parks. When I last spoke to Begging Charlie, the concern from COSATU was that vaccine mandates could possibly be unethically discriminating others in the workplace based on the jab, others who might have religious beliefs and particular beliefs around this issue. What we are doing now, he would argue, we are imputing the blame on the unvaccinated, and we seek to shame them for being unvaccinated in a place of work. I want to take a break. I'll come back and I'll give you an opportunity to weigh in on that. Let's hear your views tonight. 072-110-5584. Does an idea of having to be barred from a place of work if you're unvaccinated give you the impetus to go and get the jab? We'll continue in a moment with your views. Stay with us. Welcome back tonight with us, Mandisa Mashego, Martin Kingston, Professor Musama Shabela, Matthew Parks, as well as Reverend Kenneth Mishra and Michael Begrain. And of course, you're part of this conversation tonight on WhatsApp 072-110-5584. Otherwise, we'll read your tweets tonight at Newzroom 405. Matthew Parks, before the break, I put to you that are we now imputing a blame on the unvaccinated, and we seek to shame them for being unvaccinated?
Look, I think we need to focus on the basics. What are the fundamentals? Our fundamental mandate as COSATU is to save South Africans' lives, to save workers' lives, to protect their families, is to save the jobs of workers. We are in the deepest recession in a century. 1.5 million workers lost their jobs last year. Government doesn't have any more money to continue this fight. The Unemployment Insurance Fund cannot continue to bail out the economy. So what are the tools that we have in our hands to fight the pandemic? One is wearing the mask, is sanitizing and social distancing, but equally it's about the vaccinations. We have done well to make sure vaccines are available. We vaccinate more than 41% of society, but that's not good enough. We're quite pleased with the direction that the workers have given to us across the country, our affiliates in the education sectors, the clothing sectors, the health sectors, etc. But we need to move to a stage where everybody vaccinates. It's not about my individual rights, my individual preferences. It's about showing solidarity to the health workers who have gone through unbelievable pressures and strains. We've lost thousands of health workers. It's about providing security and protection for the elderly, for people with comorbidities. And the only way to do that is for every single person to go out and vaccinate. The vaccines have been shown to be safe, be highly effective. So we need to move that together as a society. And this is the only way we're going to emerge from the pandemic, to emerge from the lockdowns, to emerge from the recession, to ensure we protect as many people as possible, to ensure we save as many jobs as possible. We cannot simply afford to continue to lock down the economy. The UF cannot afford to continue to bail out people. We equally cannot afford to play Russian roulette with our lives, to engage in unnecessary political debates, unnecessary philosophical conversations, which might be nice for coffee table discussion. But what is clear right now is the vaccines are our best measures to save people's lives. So we need to move to a stage where we look at what are the modalities to ramp up vaccination. And this is why we appreciate the President's call last night and we support it. Let's have the discussion about how can we make sure everybody goes out and vaccinates. And Michael is correct. The Constitution has rights. Rights have limitations. Rights have responsibilities. Right. But the one right which is non-negotiable is the right to life. I have no right to risk the lives of people who are elderly, who have got comorbidities. I have the responsibility to protect them and to ensure I vaccinate as well.
Thanks, Mehdi. Let me come in there. Your 2 minutes up. Now, here's what we're going to do. I'm going to give Mandisa a minute, and I'm going to give Martin a minute as well to respond to one another. Mandisa, you raised the issue of the numbers. The death rate sitting at 89,000, according to what South Africa is raising, and Martin raising the question of 250. A quick minute for you, Mandisa, and then we'll get Martin to respond. Unmute for us, please.
Definitely 89,000. Sorry about that. Definitely 89,000. There's no debate about that. We can't be blackmailed and manipulated because people refuse to accept the realities of natural science. I cannot be at risk to somebody else if I don't have COVID. I've never had COVID. I've tested at least 3, 4, 5 times. I take care of my health, not because I can afford it, because I take the time to plant certain indigenous plants in my garden. If we change our diet, for instance, we continue allowing the world to feed us with sugar, whether it comes through medication, through food, through processed foods, etc. And as African women, we keep on keeping quiet about that. We might as well kiss our entire species goodbye. The age of people developing diabetes, hypertension, of course, contracting HIV, cardiovascular diseases such as cancer, all the different kinds of cancers is actually increasing. The rate of actually South Africans acquiring chronic conditions is increasing at a much higher rate than people are actually getting this COVID and living.
Let's leave it there. Your minute is up.
But the biggest thing is why is government not working on treatment? Why are we focusing on vaccination and not working on treatment?
All right, we'll come to that in a moment. And Martin, your minute now.
Yeah, so I think that we need to focus on just 2 things. One is how we protect lives, both those who are particularly sick from COVID and the pressure on the healthcare system, which we know has happened, not just in South Africa, but globally. Some 270,000 lives, we believe, have been lost attributable to COVID, directly or indirectly, and the economy. And as I indicated before, we cannot afford as a country, Matthew's also stressed this, we cannot afford harsher restrictions than we already have. We're at adjusted level 1. If we see a surge in infection rates and an increase in death and people who have to be hospitalized, the government will have no choice but to increase the level of lockdown restrictions, and the economy can no longer afford that, and the government doesn't have the financial wherewithal to provide the requisite support to the most vulnerable individuals and businesses. Fantastic. The only way we can do that is by vaccinating as many people as possible, as quickly as possible.
Let's leave it at that. And I want to give a minute now to Rev Mishra as well as to Michael to talk on this question of the constitutionality. It is legislated, Rev Mishra, at this particular point that this is how you protect others within the places of work. What is your reaction? Your minute starts now.
Well, I appreciate that this is one of the ways government says we will protect workers. It is not the only way. What the ACDP does not appreciate what government has done. We have called on a number of occasions that government should also speak about the importance of boosting one's immune system. It is known that vitamin C, D, and Z do help to build people's immune systems. And it is also known that ivermectin, that government does not want to acknowledge, is saving lives. There was a time when we saw, a few months ago, actually last year, when we saw people dying in India, even dropping in the street and so on. And when they turned the situation around and we asked the question, how did you do it? 97% of the remedy they used, they said, was ivermectin. So if people say vaccines are the only solutions, the only preventative measures that can be used, we do not agree with that, because if people's immune systems are boosted, they are able to resist, and even as Mandisa is saying, are also eating healthy food, natural food, those people are able to withstand and to resist.
Thanks, Rev. Your minute is up. Michael, it could be legislated, but it should not be made the only option.
It definitely isn't. It's part of the suite of cures that we have, and vaccination is obviously the part of that grouping that we need. The reality is, and I think the Reverend needs to know this, is that no one wants to undermine the Constitution. No one wants to change the Constitution. The reality is that rights are not absolute. We've got freedom of speech in South Africa, but it's not absolute. You know, and when you do Law 101, you can't shout fire in a crowded cinema because someone's going to get hurt. So the reality is that when you go to a place where there are going to be a lot of people around working together, you need to protect those people. We have it as part of our law already. I'm not sure what the debate is about. It's here. We have it in South Africa. We have some of the best labor laws in the world. And we need to understand that what we're trying to do, what we're trying to do is to protect the soil.
All right, hold on, Mandisa. We'll give an opportunity. We'll give an opportunity
now to speak, and you are now overriding my right to speak. It shows you how disingenuous you are.
Hold on, the minute is up. Okay, Michael, the minute is up. Mandisa, we'll give you your minute to come in. Prof. Moshaba, let me bring you into this conversation now. Two of the speakers on the panel have raised the issue of boosting immune system. You're the professor here. Instead of going for vaccines, let's find a cure. First question, are vaccines fully licensed? And therefore, if they aren't fully licensed, from what I understand, they're still under emergency use authorization. Can these mandates actually occur under the EUA as opposed to talking about something else?
Yeah, I think that, Thabo, if we are going to make comments about things, we must make sure that we understand what we are talking about. That's very important. And if we don't understand, we need to ask questions so that things can be clarified. The reason that we have vaccines approved under emergency use or under partial commercial is because we are dealing with a pandemic that we've only known about at the beginning of 2020. We're going on 2 years. And so many of the interventions that we've had to put in place, starting with the diagnostics, going on to the actual vaccines that we've got, and some of the treatments that have been tried, and nearly all of them have failed. Many vaccines have been tried. A lot of them did not pass. For the ones that have passed, some are authorized, of course, under emergency use. Others are under partial commercial. And in the US, FDA, Pfizer is fully licensed. But all of these things are happening in the process of authorization that is happening under duress.
All right. Are vaccine mandates ethical and justifiable in South Africa's context? Mandisa Mashego, Martin Kingston, Professor Musa Mashabela, Matthew Parks, Reverend Kenneth Mishwe, and Michael Begrame with me tonight. You are part of the conversation on Twitter at Newzroom 405, or your comments, take them live tonight on 072-110-5584. A minute for you, Prof. Mashabela. Quick one. I mean, if they are not fully licensed, why would we want to put a mandate? And would that mandate be successful?
Yeah, in a pandemic, it's not a requirement that vaccines have to be fully licensed. I think that emergency use authorization is adequate. To ask for fully licensed, knowing very well that there's not enough time to actually achieve that level of licensing, is unreasonable, because what you are saying is that we must wait for interventions before they can be used until they are fully licensed. In the meantime, what do? Watch people die? We are withholding treatment. We cannot do that. But just to answer the second question you asked about the different kinds of interventions, I accept that. I just don't think that in the context of pluralism, it means that you must take a biological problem and deal with it with a spiritual intervention. I think what it means is that you must take a spiritual problem and deal with it spiritually, a psychological with psychological. If a condition is identified in its paradigm, then you can treat it within its paradigm. I studied pluralism. I understand it. It does not necessarily put interventions against each other. It just means that you need to align interventions according to the paradigm. You know, natural interventions or traditional interventions does not necessarily mean that they are an alternative to biomedical. It just means that it's an option.
Minute is up. Mandis, let's bring you in. Treat each ailment within its paradigm.
Okay, Thabo, this is absolutely ridiculous. You know, when you resort to sarcasm and you're talking to perfectly sane people, you must know that there's a problem with your argument, because you need to belittle somebody else in order to make yourself feel like a man just for 1 second. Let's consider a few facts, right? First things first, we know a lot of people who, within the 89,000 deaths that were reported, a lot of families that all of us know individually as activists and individuals said, my family member did not die of COVID. They didn't even have COVID, right? They'll come back and argue, oh, no, you didn't test them, this and that. Let's come back to a second issue. This gentleman who just spoke now about knowing pluralism, not that anybody cares that he knows it or he doesn't know it. The issue is we can't be forced to take medicines. We are not in a Hitler era here. But one important thing that he said was, oh, we've looked into treatments. Which treatment exactly is he talking about that government looked into? Blade Zimande last year, I think it was on this platform or on another platform that I was on, he was meant to come and debate me on indigenous medicine, indigenous nutrition, and indigenous health. And he didn't come back. He promised to spend 50 million rand from the Department of Science and Technology to pursue and research into many viral conditions that can be treated by natural.
Your minute is up.
He hasn't come back. He hasn't come back with the report. They just talk and talk and talk. What treatment did they pursue? There's no treatment they pursued. They are lying. You can't trust the South African government anyway. We all know that.
Ladies and gentlemen, let's be courteous to one another. Please be nice to the other panelists in your response. Let's put an argument forward and not attack each other at a personal level. Martin Kingston, let's bring you back in here. Do we have strong behavioral scientific evidence that mandates will be highly effective? How do we know?
Well, I think it's empirical evidence, actually, that are clear. When mandates have been introduced by other countries, they have significantly boosted the level of vaccination. So the starting point in the conversation surely has to be, is vaccination one of a number of interventions that is helpful in addressing the pandemic, both from a healthcare and from an economic perspective? And it is undoubtedly the case, empirically, that it is. In France, they doubled the vaccination rate. In many other countries, we've had exactly the same experience, because people have felt that if their mobility is restricted, either in terms of employment or in terms of voluntarily wanting to exercise their rights to go to areas where they can congregate, whether that be an event, whether that be a faith-based meeting, whether that be a social gathering, that they will, given the choice, decide that vaccination is one of the options that they'll consider.
Right.
And by the way, as I'm sure you'll ask Michael, a landlord is entitled to restrict access to anybody that the landlord so desires, particularly if that person poses a threat to others within that particular location. We need to consider that very carefully and, by the way, very urgently.
Michael, a question for you. Maybe you can also tap into that, but mine will be slightly different. Can the mandates occur under the, as I put to the Prof, emergency use authorization? These are not fully licensed. In some instances, they're used as emergency. And should adverse symptoms or adverse effects happen, who is held liable? Where do the workers go?
Well, that is the problem, because the employer has an obligation in terms of our South African labor legislation, the health and safety legislation, to make sure that the staff are protected and to make sure that any visitor to the workplace is protected. Otherwise, the liability often falls on the state. It will fall on the Department of Health and Safety and Labor. The Department of Labor does not have the finances to have enough monies to pay for all the people that get sick at work. It's just impossible. The whole system will collapse.
Sorry, Mike, let me just jump in here. My question is more around, if I do take the vaccine because my place of work has mandated that I do, and I experience adverse effects, where do I go for recourse?
You have got recourse against the state. The Compensation Fund have set up a fund specifically for this. It was set up immediately to ensure that every single staff member that gets sick because of the vaccination is properly protected. You have full insurance. The funny thing is, and you can ask this of the department. The funny thing is there have been very few claims because no one is getting sick from the vaccination. So, in fact, the professor is absolutely correct. It is working. The bottom line is what Martin says is that it's helping the staff of South Africa. Every single staff member that has the vaccination then gets the COVID is in fact not dying. They're not getting ill. They're not putting pressure on the health system. They're not putting pressure on the work system. We need to get back to work in South Africa. That's the reality, because if we don't get back to work, people are going to die from all sorts of other diseases.
All right,
the
Michael,
bottom line is...
let's leave it there. I'll come back to you. Quick one for you, Matthew, and then I see Mandisa, you want to respond, and Rev will give you a minute as well to respond. Matthew, you're saying to us, if a majority of your members in the workplace say they don't want to get vaccinated, they will not be getting your support?
Well, I don't know about the majority of our members. The majority of our members have spoken very clearly, very firmly, they want to vaccinate. We recently had a COSATU Central Committee, which is a mini Congress of all of our trade unions. The mandate from that Central Committee was we must ensure we mobilize at least 80% of our members, of workers and their families, by Christmas to vaccinate. And we're well on track to do that. We've seen very positive reports from the clothing industry, from teachers, from health workers, from public servants, from farm workers who have vaccinated the numbers. We've seen some mines where 99% of workers have been vaccinated because of the work that the trade unions have been doing. We've seen many other sectors, 65% of police officers are vaccinated. But I think we must accept as leaders, we have a responsibility not engage in politics at the expense of the lives of the majority of our people. We have to save workers' lives. We have to protect the vulnerable, the comorbidities, the elderly, if indeed we're a humane society. We simply cannot afford another lockdown. The economy is on its knees. Workers are losing wages. For workers, this is not an academic debate. This is not a chance to score political points for political posturing or whatever might excite us. It's about saving lives. It's about saving jobs. Government does not have the money to maintain this lockdown. Neither can companies continue to do so. We have seen 11,000 restaurants close in the last year, throwing vulnerable, poorly paid workers into the streets. So for us, this is not a philosophical debate. It's about saving our workers, their jobs, protecting their families. But it's also quite galling that we have praised the health workers, the nurses and the doctors and the paramedics, yet we don't want to show the simple solidarity to them to do the right thing, which is to vaccinate. We've been vaccinated all our life.
A quick one, minute is up there. Let's bring in Mandis. I'll give you a minute. First, I want to bring in Rev Mishra. Rev Mishra, I'm not saying Matthew is saying that, but there are some who have said the SEDP is exploiting the political expediency of vaccine hesitancy to advance political goals.
Well, I think it is very unfortunate that people who say something like that, if you did not caution us how we treat one another, I would have said it's nonsense. But I respect you, sir, and I say it is unfortunate that there are people who say that. Now, we have said on a number of occasions that we are opposed to lockdowns. We believe we have to save lives and jobs. That is why we are saying people must be given a choice. I am glad that Martin said in one of his statements, are vaccinations one of the interventions that can be used to address challenges of COVID? And the answer is a big yes, one of the alternatives. And the other alternative is natural medicine and ivermectin. So when you impose vaccines on everybody, you are excluding other interventions which the ACP does not agree with. We believe in choice. People must be given the choice. If they want to use ivermectin, let them use ivermectin. If a person says, I've been using natural medication and I'm not sick until today, why don't we respect that? And why don't we give people the liberty, and those who don't know what that natural medication is, let them be introduced to that medication so that they can have a choice. Our position is clear, choice. No force, but choice.
Right. No force, but choice. I don't know what you want to respond to, man. There's a number of issues, but you only have a minute. So you pick which one you will take in this minute.
So, Thabo, you don't make threatening comments to other speakers, but you do it to me. It's fine. Sexism in South Africa is endemic, and we see it in the GBV stats. Firstly, France didn't double their number of vaccinations. The French president in September said he would double the number of vaccine doses they would send to Africa. They did not double the vaccinations. You can go and check those facts out for themselves. Secondly, please, Who are all of you men there in the studio to tell me that I'm politicizing issues? We've got Matthew Parks with the ANC's logo right behind his head. Talk about political posturing and trying to manipulate. Here's the reality. The restaurants are not shut down and the economy is not where it is now on its knees because of COVID. The economy is on its knees because before the COVID pandemic was even announced in South Africa, we were already in an economic slide downwards. We're in the third quarter of economic underperformance, which means minus if you did basic mathematics and science. We mustn't be made to look like we don't have brains. Let me ask you another fact. Have you been to a township lately, Mark, Michael, and Martin? Have you been? Hardly anybody wears masks there, and people are not dropping dead like flies. Like I tried to say earlier, and Thabo stopped me. Of the 89,000 reported deaths, not 200,000, Martin, please stop inflating figures and thumb-sucking stuff. I don't know where you got that from. It's 89,000. Those are the official stats from government, the government that you so love that it must vaccinate us at force. Have you been to the townships? Hardly anybody's wearing any masks there. And have you seen the number of stats, the stats that government has shared of how many people are vaccinated? If we are these crazos who can't keep ourselves healthy, and oh, by the way, was it Michael or Martin? I can't remember, one of you. I'm not a tenant, so it's no hoya scamp about people who are tenants.
I've got to go to break. I have to take the break, and I'm not picking on you. I'm not picking on you. I've put this out to everyone on the panel. Be courteous to one another. Let me take a break, and when we come back, we'll wrap up the conversation. Debate heating up, and of course, seeing lots and lots of your reaction as well. Some of you wanting to put your questions forward to our panel. Let's go to Durban. We've got Colin on the line. Colin, good evening, and thank you very much for your time. What is your comment tonight?
Good evening. Yes. What I'm trying to say to these people that are forcing us to make things mandatory, where in effect we'll lose our jobs, right? To take a vaccination that we know even they admit, right, that it does not cure a person from the COVID, and it doesn't stop a person from spreading the COVID. So whose lives are they saving? They're just trying to save their own experimental ways of forcing people to take something which is not working. And it's definitely not working because you see the variants are coming. It's got nothing to do with, having it or not having it. And I think that is very, very wrong.
All right. Stay on the line, Colin. Let's let the Prof address you on this question. Whose lives are you saving, Prof, at this particular point? Because the argument is always being put that, one, it doesn't prevent infections, but two, it also does not necessarily mean you're not going to transmit the disease.
Sure. Okay. So the vaccinations that we use, and when we are vaccinated, the evidence shows that there is 40% reduction in transmission. And that's the evidence we have. Anyone who says that the vaccine does not prevent transmission, it's incorrect. And I think the problem is we tend to speak in absolute terms about these things. The second thing that's important to note is that the vaccines will reduce severe disease, they will reduce hospitalization, and they will reduce death. All of these things are really important in terms of reducing the burden of disease on the population, the burden of demand on the healthcare system. I don't necessarily think that, people who are going to say that the vaccines don't work or vaccines don't benefit people are actually trying to speak to the evidence that is there. If we look at the evidence alone, those are the facts. Anyone disagrees with that, then they're not speaking to the science.
All right, much appreciated. Thanks. I hope that helps, Colin.
Hi.
Yes.
Okay, can I reply to that?
Yes, quick one.
Okay. First of all, I'll tell them straight to their face they are liars. Because for the confession of their own mouth, they said it does not stop COVID, right? And it does not stop it from spreading the COVID. So they are liars.
So when he tells you that it reduces transmission by 40%, you don't believe it?
It doesn't, because it's still spreading. People are still dying that have had the vaccination. people are getting sick when they have the vaccination.
All right.
They're liars.
Much
They
appreciated.
should trust God. They should trust God.
Thank you for your call. Thank you for your call tonight. Colin says we should trust God. I'm sure Reverend agreeing with that one wholeheartedly. Let's look at some of the WhatsApp messages coming through tonight on this matter. Cedric in Power, why is government not at least recommending medical checks for individuals to see if one doesn't have any underlying health conditions that may conflict with the vaccine before vaccinating people? Some have died from developing blood clots because they already had underlying conditions like heart disease, and people very close to us are partially blind after having taken the vaccine. Yes, they had eye problems before, but it worsened after taking the vaccine. And Martin, this is, I suppose, the challenge that you're going to have to deal with in business, where you're going to have to then, I suppose, make room for that kind of situation where you actually test people for underlying conditions, because if you just send them to take the vaccine, it might be a challenge.
Absolutely so. And indeed, there's provision for ensuring that if and to the extent people have particular medical conditions, or indeed there are religious reasons which would prevent them or preclude them from taking the vaccine, those need to be taken into consideration under, as I said, existing regulations. And every employer is obliged to consult extensively. This is not about some fiat that is imposed from above. It is about a further strategy, a further arrow in our quiver, if I can put it that way, to ensure that we can persuade people on the merits of the case as quickly and as effectively as possible. In the final analysis, it is government that has the responsibility to safeguard society at large, but each of us as members of society have our role to play in that regard, as do the social partners. That's exactly what we've been discussing at NEDLAC.
I appreciate you, Martin. Thank you very much. Michael, 30 seconds for you to wrap up. Your final thoughts?
Yeah, the reality is that Martin is correct. The whole Labour Relations Act has a golden thread running through it. And that golden thread is, first of all, consultation, let both sides be heard. And the second thing is that part of that consultation process, you will take into account people's realities, their religious realities, their comorbidities, everything that a person can raise is raised at the workplace. Then the workplace has to weigh that up against their operational requirements.
Right.
And once you've weighed up operational requirements and comorbidities and religion and everything else, you then see if you can use the person externally and that they don't have to come into work.
Right.
Once you've been through that whole exercise, then the reality is you then enforce the mandatory vaccination at the workplace.
We're out of time. 30 seconds up. Rev, what's your closing remark? Quick 30 seconds.
People must be given alternatives. Vaccines are not the only way of dealing with this pandemic. Those who want the vaccines can get it, but those who want to use ivermectin, and I would surprise you, Thabo, I'll speak to you privately about a person, a nursing sister, who initially wanted to resist use of ivermectin when she was dying.
Yeah.
But when she saw her children, she said, before I die, let me try this ivermectin. I'll give you the information privately.
Right. Okay.
Ivermectin saves lives.
30 seconds up. We'll do that. We'll connect. And then I'll go check that information with Prof. Moshavela as soon as you give it to me. All right. Matthew.
Check with the husband, Prof. Moshavela.
Matthew, quick 30 seconds. Your closing remarks.
Sure. Look, our key message is that the vaccines are safe. They are critical to saving lives, to protecting people from getting affected, to showing solidarity to those who are elderly, who have got comorbidities. It's about showing respect to our nurses and our doctors who have done an unbelievable amount of service to protecting the country. These are the tools within our hands to save this economy, to save the lives, to move forward as South Africa. So for us, we're going to continue to mobilize as COSATU to make sure every single one of our members and their families vaccinates. We're going to continue to work with government, with business to make sure all of us vaccinate, plus look at the other measures to help us in this fight against COVID-19. Wearing a mask and so forth.
Thanks, Matthew. Prof, final 30 seconds.
Yeah, I think mandates are not necessarily going to force vaccines into people's arms. We must be clear about that. Ivermectin, there's no evidence. The evidence that will support the use of ivermectin. And the next thing that I want to say is that for us, mandates are not meant to be permanent. They're meant to increase the vaccination coverage. Once we hit 80-90%, we can even do away with mandates. There will always be a small percentage of people who will not want to vaccinate, but the
Prof, time up. Mandis, I'll give you the final word. We literally are scraping at the bottom now. Please unmute for us, quick one.
Where are all the variants that have been here before the 5.1.1.5, whatever it is? Every time there's a new variant announced or advertised, the old variant disappears, poof, into thin air. If a variant can disappear, surely, I mean, based on the logic of government, then it means COVID-19 can disappear. Why are we not focusing on prevention? Why are we not focusing on treatment? Healthcare tells you prevent, treat, then deal with cure or inoculation. Inoculation is the last, but in South Africa and everywhere else, I suppose, in the world now, with this imperialist project that they have underway, we are all pushing for inoculation. Why is an overwhelming majority of South Africans not vaccinating? Why are we not allowed to be human beings and live our natural lives? Why is this thing turned into a religion versus politics battle? It's not. It's politicians who are trying to politicize this thing. We have one right now.
Fortunately, we are out of time.
Of a political party behind his name.
Appreciate you all for coming through and being so courteous tonight, Mandisa, and the rest, of course, of the panel, Mushabela, Matthew, Mike, and Martin, as well as Rev Meshwe.